I don't know about you, but it seems to me that allowing support people for pregnant moms in a hospital to be COVID positive is not a very good strategy. And Dr. Joe Vipond, who's an ER doc out of Calgary, doesn't agree either. But that's the new policy that's coming out of the Chief Medical Officer of Health's office. That's Dr. Dina Hinshaw. So I'm going to talk to Joe about that. Joe, welcome to the interview.
Thanks for having me on.
Well, look, Joe, you've posted the letter that explains this new updated guidance, and it points to the Dr. Hinshaw's public health order that she signed authorizing it. What's your take on it?
Well, to just be clear, it's not a new order. It occurred on July 29th. So that's when the order was signed. And that was right in the period of time where Dr. Hinshaw had declared that the pandemic was over and the endemic COVID process had begun. And we can see how that would translate into this policy, basically saying, yeah, it's totally fine to have COVID positive people come in and support laboring women in the hospital. Things have changed. The policy haven't. So the things that have changed, of course, is we're in the fourth intentionally cruel wave here. So there's a lot of community spread, and we're seeing a lot of outbreaks in hospitals. I counted this morning 27 different hospitals that have outbreaks. And so it seems wild to me that the government continues to allow people that are COVID positive into the facility without adequate protection at a time where we're trying to manage these outbreaks. So very bizarre situation.
Now, I follow a lot of doctors on social media, and I've seen a number of them discuss the issue of vaccination of pregnant women. Some of them are hesitant. They worry about the effect that the vaccine might have on their unborn child, and so they're unvaccinated. And also there are some complications with pregnant women getting COVID that wind up in hospitals. So these seem to be serious issues, and which provides some context that makes the public health order that we're talking about just seem even that much, less credible.
Yeah, so there's so much to unpack with this. That probably the biggest thing is that because they're not acknowledging airborne transmission, everybody is at risk from this policy. The healthcare workers, the mom, the newborn baby, and it's come to light that this group of people, the support worker, the mom, and the baby, once the baby is born, can be put in a postpartum ward where they can share a room with other postpartum families, despite the fact that one of them is COVID positive. So that means that all that's separating these two groups, the COVID positive group and the negative group, is a curtain and 2 meters, which of course with airborne transmission is crazy. We know that shared rooms in the hospital is a huge risk factor for transmission, hospital-acquired infections.
Right. And Energy Media has done a number of interviews with scientists and doctors about aerosol airborne transmissions. Aerosols are very fine particles like smoke. They hang in the air for hours. And the longer you spend in a room with someone who, even if they're wearing a mask, if they are COVID positive, then those aerosols get into the air and are breathed in and can infect others. And the longer you're there, the higher the risk goes up. Have I got that right, Joe?
Yeah, and it's pretty clear that the infant is not going to be wearing a mask, and likely the new mom will not be wearing a mask when she has to take it off to eat and drink. Like they're not going to be sitting in there with the mask on for the duration of their hospital visit. So this is a super high risk situation.
And the guidance that you shared a copy of, it says very clearly references droplet as opposed to aerosols. I mean, it seems to be designed around the old guidance of droplets that fall within 2 meters and touch. So it advises that the person who is COVID positive has to, say, go in a corner of the room when other healthcare workers enter, or, that sort of thing. But if from an aerosol point of view, none of that makes any difference.
Yeah, and Alberta Health Services has never acknowledged airborne transmission, and so this kind of guidance is rampant throughout our PPE guidance for healthcare workers and patients.
So how serious is this? I mean, how, should pregnant moms be worried about this, and should the rest of us be concerned at this kind of policy making within Alberta Health Services and Dr. Hinshaw's office?
I put out the tweet this morning and I've never seen such outrage. I think it just flies in the face of common sense. And also we're talking about intentionally infecting newborn babies and moms. So I think both of those things have fomented outrage amongst Alberta citizens. So I hope something comes of this.
One of the things that I don't understand, Joe, and we'll maybe wrap up the interview with this, is that in a fourth wave like this one, where ICUs are overflowing. I mean, it's a crisis in Alberta. There's no doubt about it. And even though it's not, the infections aren't rising anymore, they're still very high at around, I think Friday was 1,300. The precautionary principle seems like it should apply, that whatever you do it with an abundance of caution. This doesn't seem to be a policy based on an abundance of caution.
Yeah, it's even worse than that, especially the airborne contact droplets. It's no longer about precautionary principle. It's about intellectual dishonesty, because there is so much evidence for airborne transmission that right now continuing to apply contact droplet precautions is not based in science, and it's frankly embarrassing.
Well, Joe, thank you very much for this. Always appreciate your insights.
Thanks for having me on.